If you plan to travel once you're on Medicare, there's some important rules to be aware of because traveling can impact your initial Medicare decision. So in this video, I want to walk through how does travel impact Medicare and how will or won't Medicare cover you as you travel. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping our clients easily navigate both the government rules of Medicare, but also the insurance company options to help them do what's right and best for them when it comes to Medicare, to protect both their healthcare rights as well as their hard-earned retirement savings. We are not an agent, we are not a broker, we're not the government, so you'll hear me say very different things in these videos. And down below, I'm going to share some extra tips with you, some extra resources with you, to help you, again, easily navigate your Medicare decision. So when it comes to Medicare and traveling, there are a few important things to be aware of. Now, whether you're on original Medicare or Medicare Advantage, if you are outside of your area, outside of your local area, a medical emergency must be covered. So if you say live in Texas, but you're going to be traveling to Colorado and you have, say, a heart attack, Medicare must cover you, right? Medicare must cover you if it's a medical emergency. Now, there are some stipulations as to how much further they have to cover you for. So I want to back up 1 second. If you've seen my other videos, you've heard me talk about original Medicare versus Medicare Advantage. And there are a few factors to consider to decide which one fits you the best. And it's usually around your doctors. So my first step as you're approaching Medicare is ask your doctors what type of care, what type of insurance do they accept, right? Because you want a plan that you can see your doctor with. But if you're thinking about travel, what I will say is this, that when we have clients who are either snowbirds or who are RVing or they're just traveling a lot, they're almost always better off on original Medicare. Original Medicare covers you across the entire continental US as long as your provider accepts original Medicare, which most of them do. So if you're traveling in the US and you're on original Medicare, you have great coverage, okay, no matter where you are in the US. But if you're on Medicare Advantage, yes, Advantage plans must cover emergencies or even urgent care facilities. But there can be some gray as to what they cover after that. We have a client in New York who was traveling to Minnesota. She had a medical emergency. She was in the hospital, which her Advantage plan covered, but the plan did not cover her additional care that she needed while she was still in Minnesota. So she had some really big out-of-pocket costs for that reason. And so my point is this. Well, yes, the print on Advantage plan says that it will cover you when you travel. There can be some stipulations as to how much they're going to cover you. So if you're going to be traveling a lot, in most cases, you're going to be better off on original Medicare, meaning that you're going to have Medicare Part A and B, Medicare Part D drug plan, as well as a Medicare supplement, also called a Medigap plan. But if you're on Advantage, there are some coverage when it comes to US-based travel in medical emergencies or even going to urgent care. Now, people often ask me, but Emily, what about international travel, right? How do I get coverage when I'm in Europe for my vacation or wherever else? And the thing is, Medicare has very minimal coverage overseas. Yes, it could cover some emergencies that require inpatient hospital stays, but in most cases, Medicare will not cover you overseas. And number two, for that reason, doesn't necessarily impact your initial Medicare decision. Now, there are some facilities in, say, Mexico that do take certain Advantage plans. It doesn't happen a lot, but it does happen. But my point is that international coverage doesn't usually impact your initial Medicare decision. So it's important to think about what do you want your Medicare to do once you're on it, and what is your goal in life as you're doing it. And if travel is one of those, original Medicare is likely your best option, but there are other factors that go in to decide which one does fit you best. So I hope this helps you. I hope this helps you plan for Medicare so you can have more fun planning your travel vacations coming up. But again, Medicare can be great when you do what's right and best for you. So if you found this helpful, give us a thumbs up or let us know what your questions are down below. Here's to helping you easily make your right Medicare decision.